I'm Dr. Demetrio J. Aguila III. I'm a peripheral nerve surgeon, I'm an ear, nose, and throat surgeon, and I'm also a plastic surgeon. I'm the host and founder of the Direct Care Movement podcast, where we dive into the intricacies of direct care, whether it's direct primary care or direct surgical care. You can find out more about what this movement is and where it's going and where it came from. We're excited to have with us today Dr. Donna Corriel. I'm a big fan of hers. She is the founder of SOMI Docs, and I'm going to have her tell you a little bit about herself here. Donna, thank you for joining us.
Thank you so much for having me. I'm very excited for our conversation.
So why don't you tell us a little bit about yourself?
Absolutely. So I am a traditionally trained medical doctor. I earned a medical degree back in 2003. I then trained in internal medicine and became an internal medicine physician, practicing physician. Worked for a while at Mount Sinai in New York City at the World Trade Center Medical and Monitoring Program. So that was interesting. And then took some time off to be a mom with my third child. I actually had my first son in internship year in residency, but worked clinically around here in an outpatient clinic that was owned by a health system. And so got to experience that from the lens of a primary care physician and really got to experience firsthand all of the breaks and all the things that didn't work and why patients were really quite literally suffering, and also why doctors are suffering and burning out, et cetera. And then created SOMI Docs, which was born just as a community of docs that wanted to kind of get their voices out there. And it has slowly evolved and then gradually really had amazing momentum. And at one point I was like, you know what? I love what I'm doing. I'm really impacting healthcare positively. And I think that this will put a dent in healthcare. And so I'm going to dedicate my full time to this. And so I left clinical medicine and am sort of doctoring in other ways.
That's awesome. And it's exciting to have you on board. I didn't realize you were at Mount Sinai for a while. When were you there?
I was there. So I graduated from residency in 2006. So I was there from about 2006 for around 5 years.
Oh, gotcha. So you got to Mount Sinai just when I was leaving. I was there until I graduated from residency at Mount Sinai in 2006. I did my ENT residency there.
Did you say ENT?
Yeah, ENT.
Oh, then you overlapped. He wasn't an ENT, but you overlapped with my husband who did his internal medicine residency there from 03 to 06.
Oh, yeah. I'm sure we did. I don't know if we ran into each other.
Jared Corriel. He's a cardiologist now, but yeah.
Oh, the name does sound familiar, but obviously, you know, it's a huge system.
Of course. But good guy. Shout out to Jared Corriel.
Oh, awesome. Well, thank you. So I'm so excited. I mean, obviously you and I connected through SOMI Docs. And by the way, thank you for letting me contribute in my own way to SOMI Docs. Being able to have a voice and talk about things that other people are afraid to talk about, the kind of stuff that people want to hear, the kind of stuff that people want to know about, but, you know, they're concerned about bringing up either because they feel like, well, maybe I'm the only one that thinks this way, or maybe they're not the only one that thinks that way, but they've seen other people get gaslit for bringing up questions that people don't want to hear. And so can you tell us a little bit about the genesis of SOMI Docs and what made you decide this is what I'm going to do?
I love that you said that. I love that you mentioned that there's two different possibilities into why people can't openly vent and discuss the things that aren't necessarily working. I'm going to add a third to that could be a little bit controversial. I'm happy to talk to anybody either offline or in a different space about it. But the third possibility is that even the physicians that are creating my digital colleagues, so to speak, my physician digital colleagues, so to speak, even they are to some degree sometimes censoring our voices in ways that maybe help their own ventures. And in doing that, they also stifle really meaningful and impactful discussions. And so that is a third option that we could talk about another time. But yeah, it really got to me. First of all, it got to me that patients are reading misinformation and getting that online, right? So that was the first sort of the genesis of it, was that the doctors were looking to get online and to get on social media because they were like, we need to right these wrongs, right? So that was kind of the original reason. I think that only after that kind of became a teeny bit more accepted, I won't say popular because it's never really become too popular just yet. But only after that was accepted did things kind of evolve, and you see people coming on for other reasons. For example, to sometimes vent about how healthcare works, et cetera. You really don't see as much details, right? You don't really see doctors coming out and saying, this is exactly what doesn't work, what's not working well in my place of employment. And understandably, right? You don't have to have a degree to understand why, because it's public. It's not like you're venting to your therapist, you're putting it out there, and your employer can read it. And if you're going to complain about your employer doesn't necessarily have to keep you employed. And then on top of that, we've got all our the virtual handcuffs that we have on. And so we cannot really move about freely, so to speak. So the birth of SOMI Docs came about for many reasons, but one of the things that it affords us is really a place where we can talk about the things that don't work. We could do it anonymously. We could do it courageously, like you have done. I can say that your articles that you've submitted to our magazine are phenomenal. You're a really great writer, and your message really came across, and you're also a storyteller. So in telling us the past of your own family's experiences, not just with doctors, but being doctors, you really help to teach our audience. Obviously, we need more than just a few of us speaking up, but that's where the catch-22 takes place, because unless you've really kind of cut ties with the medical system and the healthcare system, you can't always openly and freely complain about the things that don't work.
Sure. Well, and that's a huge challenge these days. We were talking earlier before we started recording. There's a medical student that is very interested in coming on and having these conversations with us, but she backed out because she was concerned that that if she spoke openly about a lot of these questions, it would have a detrimental impact on her career. I mean, there are situations in which people get that they get canned from their residency or their fellowship program. And of course they don't tell them, oh, well, the reason we're doing this is because you complained. It's, they come up with some other explanation, but the reality is that, oh, well, you're the squeaky wheel. We're not going to oil that wheel. We're just going to get rid of it.
I can't blame her. That's number one. But number two, of course they do that because they are entrepreneurially minded and they're smart and they're strategic. And I have advocated tirelessly that physicians should be entrepreneurially minded for a really long time. And I've gotten a lot of pushback about that from other physicians. And I really just still to this day don't get why. I think that we're so averse to that term. That term to many doctors just means sell, like you're a snake oil salesman. And that's not what that term means. It just means being clever, being smart about how processes work, how systems work, how they employ you, and who you are as sometimes, unfortunately, as a cog in their wheel, and how you can leverage that to really hopefully maximize how your medical career goes.
Absolutely. Yeah, I love how you put that. We often end up being just widget makers on an assembly line, and often our role as physicians is devalued because we're so disconnected from the decision makers. We are no longer the decision makers when we work within a larger system, and so one of the reasons for this podcast is so that we can talk to medical students and residents and fellows and people who are recent graduates and talk to them about the kind of value that we bring as physicians and why it's important for us to understand that value and then be able to convey that value to our patients and really to reestablish that doctor-patient relationship and understand that entrepreneur is not a dirty word and money is not a four-letter word. And we spend a lot of time as physicians talking about the risks, benefits, and alternatives of treatments with patients from a medical standpoint. Isn't it only fair that we should talk to them about the risks, benefits, and alternatives from a financial standpoint also? But when we're working within a big system like that, very often, like you said, we're handcuffed, right? Can you tell us a little bit more about the handcuffs that you were able to shed in making the transition from your previous practice to what you're doing now?
Yeah. And I think that I do want to add that you mentioned students, and I know that this specifically is geared towards students. So I think it's relevant for me to say that, unfortunately, students, we train. I always kind of give the analogy of this like opaque box, this black box that you can't see inside. And what happens in training kind of stays in training, right? And you come out on the other end and you're like ready for real life. And you sort of just automatically, most of us are automatically just going to work for the employers, right? We're going to work for the system that trained us, or a system just like them, because that's actually how we're trained. And so students don't know any different. Residents don't know any different, because the attendings that are teaching them are those that are employed by the system. So they aren't necessarily getting different perspectives, different kinds of practices. And it actually works to the system's favor, because then they get to sort of uphold their monopoly in the way that that's run and kind of rule the roost. And again, not necessarily trying to vilify them here. Obviously, we need hospitals. We need places to stay when we're actually acutely ill. We need ICUs. We need machinery that individually we cannot afford. But I do actually believe that the system would run much, much better if we were almost like freelancers and we worked individually in our private practices. We own them ourselves. We made the decisions right there and then where the visit is. And then we worked in a freelance sort of agreement with the hospital, who doesn't literally like own you. And that's what I felt was happening. And not just because of my specific hospital, it happens everywhere. And it now happens to all specialties, unfortunately, that the hospital system is slowly gobbling up every independent physician so that they will own you and own how you practice. And then what happens is that the person at the top is making the rules. They're not there. The patient suffers. The doctor is suffering and burning out because they feel like they're being dictated what to do. Insurance companies are coming in from the side and, contributing their own, annoyances to this process. And there's a lot of what I call middles. And the middles really fatten up that relationship so that we are distant. As physicians, we are distant from our patient. And we're not actually like in control of that situation, whereas it really should be the patient and the physician in control. So how did I break the chains? Listen, I decided to do something out of the box that worked. I decided that I had a solution. I don't have all solutions, but I do have some solutions for regaining autonomy, for promoting autonomy for the healthcare experts of today, us, the physicians and beyond. And I also, probably have some luck. I do feel like I have some talents that I found out I had when I took time off. And so I'm now using those talents combined with my passion and combined with the fact that I actually love what I do more than ever. And I'm helping patients, I'm helping doctors, I'm helping healthcare, and I'm actually making a difference. So I broke those chains because I was able to think outside of the box many, many years ago with a vision, and to slowly build it, to persevere and to not give up.
That's awesome. That's awesome. And I loved how you said you thought outside the box. I mean, in our conversations and in reading what you write and in hearing your interviews, that's a theme that comes across repeatedly, is this idea of thinking outside the box. I am a firm believer that as physicians, collectively, we're some of the smartest people in the entire country. And I refuse to believe that we can't fix the problems with healthcare that we're facing. And the only reason it hasn't happened is because, like you said, we've got handcuffs on and we're afraid to try to break them. We haven't given ourselves permission to think outside the box, or in some cases, throw away the box.
It's that, what I termed and referred to earlier, is it's that opaque box, that black box that we go into when we train, right? To me, you start out before you enter the box when you're pre-medical and you've got your life ahead of you and you're motivated and passionate and excited and you are the brightest of the brightest, right? You're the top, you're the cream of the crop, and you're really well-rounded at that point. And you're ready and you're like, yes, I got into med school. Yeah. And you go into that box And in that box happen all these things that no one on the outside sees, but you and I, Demetrio, we see it because we've been through it. So we know what it's like to, spend your nights, your days and nights studying, and all the missed opportunities, all our friends starting families and building homes, etc. But the point is, you come out from the other side a different person. Now you're ready to be a physician, but you're a different person. A lot of those people have lost their lights, have lost their excitement, have lost their passion. They are on the road to doing exactly what medicine tells them to do. That, again, that traditional path that has been taught to them by the system, by the system's attendings. And you're a little bit like a robot, like, okay, this is how I practice medicine. No, right?
Exactly.
The world is our oyster, and innovation is where it's at. The rest of the world and the rest of the fields within it, they're innovating freely, right? But medicine isn't, partly because of that, and partly because we're just so afraid of doing the wrong thing, harming patients, and getting judged, because you do get judged in medicine, and that's, we're people pleasers. So we just want to do right. We just want to do right. And again, that's part of the problem with stifling us and us not innovating and kind of being robots and doing what we're just what we're supposed to do.
Right, exactly. So can you tell us a little bit about your thoughts on how the financial pressures that we see within the healthcare system are really putting physicians, particularly medical students who are going to be going into residency? I mean, they get these handcuffs placed on them when they sign, on the dotted line for the match, and then when they finish their residency or their fellowship and they're going out looking for jobs, they put on bigger golden handcuffs, and then they wonder to themselves, why am I getting burnt out?
Totally. So you have to understand, the listener listening, or even the student listening that doesn't yet realize this is what's happening, right? They strip you of your finances because you're like $1 million in debt, or $500,000 or two, whatever, right? You take out loans. Every step along that process costs so much money. And it's like 8 to 10 to 12 years of this, right? So you near the end, basically in very, very high debt, and you're then presented with a contract, right? And that contract is coming from the health system, right? That really lucrative contract that you cannot look away from. And you're like, score. But you're not actually thinking about all the other variables that are going into the contract, namely that you are further getting locked in and that you are going to be owned. And that's why, for example, we have signed so many contracts that had like all of those, really those clauses and such that don't work for us, that don't allow us our freedoms, right? Even the restrictive covenants and things that don't allow us to practice nearby if we, break off ties, or if we decide to work somewhere else, or if we're fired, right? So we're really just jumping at the bit to sign that contract. And the health systems know that. And they're billion-dollar companies, and they could afford to throw a really nice bone over at the doctors, including a bonus or whatever it is that they throw our way. And that's just so much easier than, if you think about it, than starting your own private practice, where once again, you're going to be even more in debt, because you're going to have to now rent a property or purchase a property. You're going to have to pay your staff. You're going to have to figure out billing. You're going to have to do all these things and pay for them. And at the end of the day, that's when an actual business entrepreneur, that's the term business entrepreneur applies. That's where we get overwhelmed and we're like, no, I can't be my own boss, because first of all, no one's taught me, right? I've only been taught by the attendings that work for the employer, because the system's not going to like put you in touch with private practice doctors, right? And that's part of what I'm doing with SOMI Docs, is I opened a student section, because I'm like, let me really slowly introduce these pre-medical and medical students to the real world. Like, yeah, you may be training in healthcare system X, but that doesn't mean you can't be part of this virtual community called SOMI Docs, where you're going to be put in touch with lecturers, etc., that will teach you the ways of life outside of that sort of indoctrination that's going on inside of that opaque black box.
Yeah, for sure. So let me ask you this. Let's get straight to the point then. You have this medical student that's listening right now, or you have this, this resident who's now locked into this residency program, and is thinking about, okay, this all sounds horrible. And I'm going to be a slave. I'm going to be an indentured servant for the rest of my life. What are the alternatives? What's the solution? Or at least what's part of the solution? What are some of the pathways that we can free ourselves of these shackles and get back to the doctor-patient relationship the way it used to be? Like, you referenced the articles that I wrote for SOMI Docs, and where I talked about how when I was 14 years old, I was my dad's billing manager. Is it because I'm some kind of super rock star genius when it comes to math and billing? No, it's because it was simple, because there was a doctor-patient relationship, and insurance wasn't involved, and it was affordable. It was good for the patients. It was good for the doctor. How do we advise these doctors in training and these doctors to be, and how do we help restore hope so that they can think outside the box?
Well, this is a very long and nuanced discussion, and it's something that we all need to figure out. I mean, right off the top of my head, I can say that, first of all, there's nothing wrong with working for an employer, because that's unfortunately our reality. So maybe the truth is that the resident coming out of residency does sign up with the employer temporarily, knowing that they're going to be maybe setting themselves up for a future breaking off and starting their own private practice. Maybe as they work and, generate money to pay off some of their loans, they're also on the side building that space, getting an EMR system that works for them privately outside of their employer. What's another important point is that they need to make sure that their contracts are written really, really well, where they can escape. I hate to say it that way, but really like cut off ties with the employer in a way that's still conducive to practicing medicine well. Because if you're going to leave them and you want to not move with your family to another state, and you want to stay local, that may be an issue for the employer, right? These systems are behemoths. They muscle their way in. They want to own everything, right? They kind of like own the patients. So you want to make sure that it's written in your contract that you are, a free, like a person who's free to do other things. I don't want to like overwhelm everyone with analogies, but I do like to think of it a little bit like movie stars that are starring in movies, right? Like, sure. You don't want to star in a movie and be like, this is the only movie I'm ever going to make. Like, no, you want to be able to build other movies and be the stars of other movies. So like, yeah, sometimes if you're filming a movie, you might start filming another movie. I mean, the movie A is not going to love that you're working for movie B, but sometimes that's necessary in order to get up on your feet. Those are things that you have to work out with the hospital. Sure. The other really important thing that I am confident of is that everybody needs to brand, right? I'm a branding consultant for a reason. And this is actually the reason, is that everybody needs to brand. Everybody needs to build presence and establish who they are outside of their employer, right? The traditional way of working for the employer, you're kind of branding, but you're branding right along with that employer. And so when you do break off, when either you leave or are worse, when you're fired, you're not really your own entity. Like the patients sort of just kind of stay there because it's like, okay, like they left and I love that doctor, but like it's just easy to stay here. I envision a world where the doctors either leave or are fired, but can, it's capitalism, right? They can build a competing space not far away where the patient has an option. Now I have an option to go see my outpatient physician, whether it's, in the system or out there in the real world where they're working privately. They're giving me a lot of attention. And I like this way better because there's no like admin on top telling the doctor what to do. The doctor's actually the boss, which is a good thing. Yes. We're far from that happening, and understand that there's many reasons why we can't do that tomorrow or the next day or next year. But we're slowly seeing doctors breaking off and figuring out at least how to do it. But there's going to be a lot of work that needs to be put in, and also government work and lobbying for the doctors and not for these healthcare behemoths and insurance companies, et cetera.
Awesome. Well, thank you so much for that. So before we tie up, can you tell us a little bit more about SOMI Docs, and specifically, you mentioned an arm of SOMI Docs which is really focusing on medical students. Some of our listeners right now are wondering to themselves, okay, what is this SOMI Docs, and how do I find this, and how do I get plugged in? How do I get plugged in with other people that think like Demetrio and think like Donna and other people like that, where I can turn to for advice and guidance and mentorship?
We are so out there, guys, and we are such a warm and inviting community, and we hear you. We get you. We actually probably get you more than anyone else because we're suffering right alongside of you, and we are kind, compassionate people who wanted to really just heal and were frustrated. So we're also very entrepreneurially minded. So we believe in autonomy for physicians. So we're at the public website is doctorsunsocialmedia.com. We do have 3 public arms, so you can look through it. We have content, we have directories, and we have lectures where we have all kinds of virtual conferences happening every month that we bring in experts for, and it works just like an in-person conference. But the really cool part is that it's free while it's live, and it's really never been done before, so it's exciting. But we also have memberships. We have memberships for students, for doctors, and soon for experts for doctors. But the student membership itself, it's priced very reasonably. Off the top of my head, at the point of this recording, it's $50 for the year. And you come in and you, first of all, get to be in a directory for students. And I don't want to take up too much time talking about that directory, but the whole point of that directory is the beginnings of PR and marketing for you as an individual, because I do believe, again, in branding yourself, whether you're in the doctor stage, attending stage, or you are in the student, either pre-med or medical student stage. So we provide a teeny bit of that in a public directory, right? PR and marketing there. And then we provide a lecture series on optimizing the interview and application process that's going on now. But we also have all our conferences, and we have other things that are coming for students that are evolving, especially as we grow bigger, and especially as the attending arm is growing. We're eventually going to figure out ways to mesh the two together and to really get more mentorship and impact in the way that you and I want.
That's awesome. Well, I'm really excited that we were able to have you on board today. I'm glad we were able to coordinate our schedules so that we could have this conversation. Let me ask you this, because there's so many different things we could talk about. Would you be open to joining us for another episode at some point in the future?
Of course.
That's always very exciting. Thank you. Well, Dr. Corriel, Donna, I'm so grateful that you were able to join us today. It was exciting having you on our podcast, and I look forward to growing this movement together. Thank you for joining us.
Thank you so much.
Thank you for joining us on the Direct Care Movement podcast. We're excited that you joined us, and we're looking forward to having you join us in future episodes as we dive into more questions and more concerns and more solutions in the direct care space, whether it's direct primary care or direct specialty care. If you liked what you heard and you want to know more, please click like and subscribe and leave us a review. And don't be afraid to reach out to us directly so we can get you more information about direct care, whether it's direct primary care or direct specialty care.